Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and I am super excited about this week's episode because we have the Smiths. We're going to be having a show about facelifts, which I've got a tremendous number of inquiries on social media and whatnot, because facelifts are on the rise, super popular, and very confusing. So we are lucky, we are honored to have Sam and Lance, who both underwent facial rejuvenation, and we're going to talk about it. We're going to talk about pre-op evaluation. We're going to talk about the surgery itself. We're going to talk about recovery. We're going to talk about risks. All right. So welcome to the show, guys. Thanks for coming on.
Thanks.
You guys live up north? Yes. Yes. So that's quite a trek. Did you drive or fly?
Flew.
All right. Okay. I was going to say, I'm pretty impressed if you can drive down the ocean, see beautiful down. Nah, just fly.
I flew the JSX.
I love it.
Incredible.
I love it. Okay. So let's chat a little bit. What are the things, and I'm going to give some background to the people listening, because facelifts are like trending everywhere on social media. And social media, let's be honest, drives what we do, whether or not it's, they're using this kitchen knife. Oh my God, did you hear about this new bear spray? Everything is being pushed on social media. And so facelifts are on the rise because there's a major shift occurring. What's that major shift? The major shift is 10 years ago. 10 years ago, when you said the word facelift, immediately in your brain, you thought 70-year-old, right?
Yes.
Sure.
Right?
Yeah.
If I said to you, you don't know much about plastic surgery, but like, what age did you get a facelift? Guarantee you'd say 70. Late 60s, early 70s, right?
Yeah.
How old are you?
55.
How old were you when you had your surgery?
53.
53. How old are you?
53.
Okay, so you both had facelifts at 53. Well, guess what? That's the new average. And the question is, does that mean we're becoming plastic surgery junkies? No, because it was an error to do it in your 70s. I did all three of my nieces' nose jobs. 16, 8, 17, and 20. Why would you operate on a 17-year-old? It's totally fine. But then when you want to do a facelift, you got to wait till you're 70, because we had the stigmata was linked. And if you were 53 and you started having earlier signs, what are the signs? There's three classic signs of, oh shit, I think I'm getting to needing a facelift. One, marionette. This thing here, which is a marionette, like a puppet doll that moves up and down. There's a line here that is starting to get deep. Two, a jowl. A jowl is that my jawline used to be crisp, and now it's got this like wavy thing to it. And three, I never had all this garbage in my neck. It's like this loose turkey neck skin, this fat in here. Those are the three key components that your face is aging towards needing rejuvenation. Notice, none of that shit was even involving the face. That's all the neck. So first misnomer is facelift means pulling my face. No, a facelift is lifting up the skin of the neck and face, but moving it out through the face itself. So we'll get into those details. So now, when you're in your late 40s and early 50s, and you're starting to see the jowling and the marionettes, whatever, you can do something about it. It's the same damn thing you were doing at 70, except you do a little lesser of it, right? Because you have less of all of that. So I love that paradigm shift because I think it is the right thing. And nothing has changed other than removing the stigmata. The veil has been removed. And now it's being pushed. And now I'm getting calls from like 35-year-olds. Like, can I do a preventive facelift? I'm like, no, that's crazy. But I love the fact that young people don't have to wait until they look like a train wreck to allow themselves to improve it, right? Because when are you going to enjoy it? In your 50s and 60s.
No.
You're not going to enjoy it as much in your 70s. Well, does that mean you're going to need another one? Who gives a shit? You've enjoyed 20 years of it looking good. Of course, if you do it at 50, you're going to keep aging, and you'll maybe need a touch-up at 65 or 70, but you're going to look 1,000 times better during those 15 or 20 years.
Sure.
Okay, so let's shift to what are facelifts and how are they divided? So facelifts are divided, and we talked about this, right? You came to me and you said, hey, Dr. Rahban, in your instance, as well as yours, two things led to you needing the facelift. One 50s. So everybody in their 50s, I'm turning 50. I have this skin that I never had. And if I lean forward, I started to have this looseness. It's going to happen. But in your instance, the added element was that you had lost over 100 pounds.
Yes.
Through your bariatric journey, you lost a lot of weight.
Sure.
Everyone that loses 100 pounds has loose skin in their face. It doesn't matter if you're 23.
Yeah.
So you add that plus your age, and your guys were perfect candidates for needing some rejuvenation. So the terminology is very tricky. We have facelift, mini facelift, neck lift, and then we have all these other subsidiaries where it's called the blah 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 lift, the blah 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 lift, the lifestyle lift, the weight gain lift, the bacon cheeseburger lift. So let's get all this nonsense sorted out. They're all the same. They're all the same in that the skin in the neck can only be moved through the face. So if you're watching, you see that I take this skin, I'm not going to pull the skin back behind my neck. The term neck lift is used because patients don't like the sound of facelift. It's less alarming. It's less insulting. So if I get a patient who's like, oh, my facelift. Okay, you're getting a neck lift. Oh, okay, I can do a neck lift. Where the hell am I going to move the skin of the neck? Through the face. So they're all the same. Mini versus regular is nonsense as well. It just means at 47, you have a mini. At 67, you have a regular. It's the same surgery, it's just more of it.
Sure.
Right? So that makes sense. All of them essentially have some key similarities, and yours are the same. First is, where are the incisions? Almost all, this is again, almost all facelifts have a component under the chin, right? And that is what allows us to go into your neck, fix muscles, remove fat, whatever. That gives you access to the neck. And then a component within the area of the ear. So when we say the area of the ear and why facelifts are so powerful is that it's hidden. It's in the inner line of the ear, not in front of the ear, and then behind the ear in the sulcus. So almost all facelifts have something under the neck and in front and behind the ear. Where you get variations is the more skin you have, the longer the scar in the face becomes. So if you have a lot of loose skin, your skin, the scar in the ear, extends into the hairline, and the scar behind the ear goes down the hairline. In other words, it just gets longer, hence mini versus long. The other component of is, what are we doing to the stuff underneath? So there's two parts to your face. There's the skin, and then there's the muscles. So the skin part is the loose skin that you have. And back in the day, what they would do is just go underneath the skin, separate it all, pull the skin, cut out the excess, and tie it down. And that facelift is called a skin-only facelift, and it's okay. But what we've learned about that is we know skin is kind of flimsy. It doesn't hold, it pulls. And what we realize is the part that's actually sagging is the muscle layer under the skin. And so today, modern day advanced facelifts, the ones you both had, are a deep plane, dual plane, SMAS plication. They're all the same. What it means is you lift up the skin, you find the muscle layer. Oh, there it is. You do something to the muscle layer, which is either you suture it, sew it together, you cut it and lift it, or go underneath it, separate it, but you are lifting the muscle layer separate than the skin, and then you remove the excess skin. And so what you guys had was that, and that is the gold standard, and that's what's called a deep plane or a SMAS lift or what have you, okay? Doctors love marketing. And why they love marketing is neither of you had to be exposed to this, because how did we meet?
Through our daughter.
Through your daughter.
Yeah.
Right? Your daughter had her nose done. And so you guys had that introduction. Everybody else has to go online and do all kinds of unnecessary research. And they're going to come across the midnight lift, the lunchtime lift, the so-and-so lift. So doctors love to stick, for example, be very common, called the Rahban lift or the Lasky lift, meaning we're on Lasky Drive. Basically, it's just proprietary nonsense. But there are always going to be these variations of things. Okay? So now let's address you together. So Sam, you came in, you're a beautiful young lady. And when I do facial analysis, we definitely don't just look at your neck and call it a day. Unlike your breasts that are its own entity, a face starts at the forehead and ends at the bottom of your neck. You can't look at you and go, wow, she looks really good, and ignore your eyelids and just look at your neck. Right. What if your neck looks the same age as your daughter's, but your eyelids look like you're 53?
Yeah, that would work.
It doesn't really work. So when we analyze people for facial rejuvenation, we do so as a collective whole because the objective is for you to walk into a room like, God damn it, Lance looks good, right? And the idea is for us to look at you collectively and say you look good. You can't look good if your under eyes or your brow or whatever. So when we met and we analyzed you, what were the key components? What were the things that we noted together? So let's go through them one by one. Okay. I always start from the top and work my way down.
Okay.
So
the eye. Oh, you're going
to tell me.
Okay, my eyes,
your brows.
Yeah, my brows, they were sagging.
Right.
Yeah.
You had already done your upper eyelids, correct? Yes. Then we skipped to your lower eyelids, and your lower eyelids had some loose skin and crepiness to them.
A lot.
Right. And then we skip down and we look at the three areas, which were the jowls, the marionettes, and the neck, right? Your lips have always been beautiful. Your cheeks have always been full. And in your instance, which is a separate entity, you hated your nose. And that will kind of portion out of the facial rejuvenation.
Okay.
So what did we do for you is we did a brow lift, right? And we did that through the hair, right? Your hair, if we parted it, you wouldn't be able to see it. It's in your hair. We lifted your brow so that you wouldn't have sagging on the side. You already had some skin removed from your upper eyelid, so we left that alone. The reason why the lower eyelid, which you end up having as well, is important is because when you do a facelift and you lift the face, what's happening to my lower eyelid?
Extra skin.
It's extra skin. So if you're starting out with extra skin under your eyelid, skin or fat, and then I do a facelift and I do a good job of lifting some of the excess, you're going to get more lower eyelid skin. So in you, we removed lower eyelid skin and fat, and then we did this dual plane or deep plane facelift, right?
We got rid of the jowls.
We got rid of the jowls. We
shaped me a chin.
We got you. We improved. You had a good jawline to begin with. We cleaned up the loose skin in your neck. We sewed your muscles that were in the midline, your platysmal muscles, right? And you like this, and you can see those muscles. We sewed them together so they wouldn't be pulled apart. And we took all of that from the back and through the skin in the back. Okay? Okay. Then you go home and your husband's like, holy shit, this looks fantastic. And your husband, as we had discussed previously, is just a regular guy's guy. You guys are in the steel business. He has guns, knives. Why I mention that? Why is that relevant? It's relevant because people assume that this is a woman's procedure and that if you do it as a man, you must be a very effeminate, flamboyant male who's really into themselves. Well, Lance isn't striking as a guy that's super into himself, right? Lance is a garden variety, and I mean that with the utmost respect, guy's guy. But he had mentioned, what was it that triggered your desire to do your face?
I got my passport photo back and the marionette and the loose turkey neck and I just thought, I can change this.
You looked at yourself from a different perspective. Sometimes you got to look at yourself on a camera or in a TV or you go, oh my God, is that me? And you thought to yourself, well, why? And your wife was where in that journey already? Had she already done it? She was about to do it. She had already met with me. Where was she in the journey?
She'd already recovered from the procedure.
Right. So it is super common to say, wow, if she can do it, I can do it. It's so powerful to see someone else go through something and then to realize it's doable and it's within reach.
Yes.
So here you are, a guy, and you decided, well, my wife's going to look great. We lost weight together. You guys had lost weight together, and you had the excess skin, and you and I met. And what were the things that you and I discussed? What were the items?
The same thing, pulling the neck and face back.
Correct.
And then I had some bags under the eye, and like you said, you have more skin.
Exactly.
So we did a lower eye lift.
Right. And then in your instance, unlike your wife who has beautiful full cheeks, you're a quintessential man. You have flat cheeks, as do I. And when you lose weight, they hollow. And so in your instance, we added some fat transfer, some volume into your cheeks in order to give them a little bit of normalcy.
Yes.
In a woman, we like full. In a man, we like neutral, right?
Yes, we did.
Right. So in you, we did the facelift, same thing. We did your lower eyelids and we did some fat transfer. All right, so here we go. Let's talk about your recovery. Your surgery, the facial portion, took how long?
To recover?
No, the actual surgery itself.
Oh, hours.
Hours.
Yeah, hours.
Right? Like,
Yeah.
I want to say your facelift, eyelid, a brow lift, rhinoplasty. I think the whole thing probably took 8 hours.
Yeah.
Right? 8 hours? Oh my God, what? 8 hours? Is that crazy? She could have done. No, it takes 8 hours. It takes, how long does it take to make brisket?
Yeah.
I mean, how long does it
Right.
Well, Thanksgiving's around the corner. How long is it going to take you to make a turkey? Well, what if anyone says they're going to do your facelift, eyelids, your nose, etc., and they're going to be out of there in 3-4 hours? You better run for the hills, because if to do it the way I'm describing, open up the face, find the muscles, get underneath the muscles, lift the muscles, sew everything yourself, do the brows, do the eyelids, do the nose. If it's anything shy of what I just said to you, something doesn't add up.
Yeah.
Right? So you were under anesthesia for 8 hours. You awoken without an issue. People are under the impression, oh my gosh, she must have been in recovery for days. No, you left after an hour.
Yeah.
Lance came, I remember.
Yeah.
And then you went to a recovery center.
The hotel.
To the hotel. You had a nurse, right?
Yeah.
Okay. And so you had 2 drains, right? One on the left, one on the right. You were there to take care of her. Let's talk about the recovery. Because generally what I tell patients is breast augmentation, mildly or moderately uncomfortable. Tummy tuck, mildly and moderately uncomfortable. Facelift, eyelids, noses shouldn't be that uncomfortable. Not relative to those other surgeries like a hysterectomy or a C-section or a broken femur or a hip replacement, because facial skin and that area isn't that painful. What was your experience? What was your recovery like?
It was pretty quick. The recovery was pretty quick. I mean, after a couple of days, I was probably fine.
Were you in a tremendous amount of pain?
No,
You were uncomfortable.
I was uncomfortable.
Right, but were you in tremendous amount of pain? You had other surgeries, right?
Yes.
What would you compare the pain of your face stuff to the pain of your tummy tuck or your body lift?
Tummy tuck was much more painful.
Much more, right? Yeah, we do that day in and day out.
Yeah.
The reason I bring it to the attention is because nothing is without discomfort. You get your teeth pulled, but I want people to understand the relativeness of it. I tell people C-section above a tummy tuck, a tummy tuck above a facelift, right? And you had your tummy tuck.
Yeah.
And then your face. Would you agree that your experience as far as the pain, the face was lesser than the tummy?
I would agree.
Right. The going back to, I feel pretty good, much faster in the face than in the body. Tummy tuck takes a good 10 days. You gotta, 2 weeks, I'm still, Face is like, I feel pretty good after a week or 5 days.
Yeah. Yeah, it was we were quick healers.
Right. So when the drains come out, we took out the drains. Why do I leave drains? There's a lot of discussion about it. I leave drains because despite all the beautiful work we do, after surgery, patients often swell up and they tend to leak for a day or two. And I'm trying to get that fluid out as fast as I can so that it doesn't stay in there and cause more bruising and swelling. So 48 hours or so, we take out the drains. Can't even feel those. And within a week, you feel pretty darn good.
Yeah.
Right? Now you're taking care of her. What is your experience as the caretaker of her? What did you know? Was she incapacitated? Was she actually relatively mobile? How much help did she do?
Well, the first couple of days, a lot of sleeping. The first couple of days, and then after the drains came out, a lot of more mobility, up and watching TV and FaceTime and all that.
Right. So here you were. You had brow, eyelid, nose, face, right? And within about a week, which sounds pretty reasonable, you feel pretty damn good.
Yeah.
Right? And the way I do it is there's tons of sutures deep,
Yeah.
but there's a lot of sutures on the outside because I want that edge to be perfect. So I put a lot of permanent sutures that I need to remove. So I see you at 1 to 2 days. I see you at 5 days. I see you at 9 days. I see you at 14 days. I don't see any patient as much as I see a facelift patient because I'm taking out sutures at different times of recovery. But at a week, yeah, you're a little black and blue, and yeah, some areas look a little tighter than others, but by no means you feel pretty good, right?
Yes.
If I didn't tell you, you gotta chill X.
Yeah.
You
I would've went home.
You would have been home, right? Okay, great. And as a caregiver, it wasn't like a horrific experience for her, right?
No, it wasn't bad at all.
Right? And so it wasn't bad enough, so bad enough that you decided to do it, right? If she had done this surgery and she was in agony, I mean, she's just wailing. It took her weeks to recover. She had a horrible appearance for a while. Even if she looked incredible, there's a possibility that you were like, screw this shit.
Yeah, it may have swayed me the other way, but the recovery wasn't that bad at all. I mean, like you say, within a week, going to the store, sunglasses on,
Yeah, you tell me, lay down, stop touching your bandages, leave it alone.
All right, so I think it's really important. We're not overselling it. We're just trying not to undersell it. We're just trying to speak the truth. And so now in reverse, your experience of your face surgery, would you say that you had a lot of discomfort, or it was like, it's tolerable?
No, it's very tolerable.
Right? I think he had less pain than you.
A lot less pain. I was like,
Right.
Well, yeah,
you are more customary. You were a little bit more uncomfortable. But given that you had already pain within your body from your tummy tuck, you could tell me the relevance.
sure.
Because that's more like, when I tell patients, they're like, oh my God, I've looked at people's recovery online. They look like shit. You assume they're going to be in agony. But then they're usually like Lance. They're usually like, well, this doesn't hurt at all.
Right. He's like, that wasn't bad. Yeah.
I had a little less work done. I didn't have my nose done.
But noses of all of it have the least amount of pain. By
Okay, yeah, I don't know.
Yeah.
I can't speak to that, but yeah, it was the recovery for me. It was super easy.
Right.
Really.
So same thing, and you watched it, and you're like, well, that mother effer. He's just.
I'm a good nurse.
He's just going through. Yeah, you were a shitty nurse, and notice how at the end she'll take credit for your quick recovery. So at any rate, the point being is that both of you realized that it's doable. The recovery was pretty straightforward. Your surgery took 5.5 hours. Your surgery was 8.5 hours, and as a result, you both experienced similar experiences, which is interesting because it proves that this is actually probably how it normally is. It's normal. Pain should be within reason. You should be feeling pretty good at 5 to 7 days. Sutures are coming out throughout the week. And when do you feel like, okay, I don't look ready to go on, national TV, but when did you feel like, okay, I can put on some makeup and I can go probably back to work and just do my basics?
Oh, within 2 weeks, I think we even got to go home a day early. I begged to go home.
I think still had some black and bluing maybe a little after that, but it was nothing to.
Yeah, it was pretty quick.
Yeah, so I tell patients, 2 weeks, you go back to work. And it was like clockwork.
Yeah.
At 2 weeks, yes, you weren't perfect yet. You wouldn't have accepted your Oscar.
Yeah.
But you were ready to go back to work, and you were ready to put on your sunglasses and go if you had to pick up
Still
your
swelling.
kids.
Yeah.
Yeah. And then I see you again at 6 weeks.
Yeah.
And I tell you, go for it. I don't give a shit what you do. Go climb Everest. Start Krav Maga. Go do jiu-jitsu. Go, because at 6 weeks, while you have just a little bit of swelling left, facial-wise, everything is healed enough that I'm not worried about anything. And you can go and live your lives, right? Would you agree?
Yep.
And by 6 weeks, people are itching. I'm very conservative. You probably could have kicked ass at 4 weeks, but I kind of forced you to wait 6 weeks. Sure. Was that your experience?
Yes. Yeah. Yeah. I tried to do less. I'm a doer, but
Right.
6 weeks I was ready to go. And before then I was really ready to go.
Exactly.
But you tell me.
Yeah. And Lance, you at 6 weeks, 6 weeks, you were what?
Yeah, 100%.
100%, right? Like, no, God, I still have this or that or whatever. Now, you'll always have a little bit of numbness.
Yeah.
You'll have a little bit of numbness.
Yeah.
That takes months, but that's not pain or ache or restriction, right?
But he didn't have the numbness like I had.
Yeah, you're just difficult.
Very minimal.
Yeah. I'm like, isn't it numb here? He's like, no.
Yeah. I just
Does it hurt?
I take better care of it.
Yeah.
So we're going to take a quick break, and then we're going to come back, and then we're going to talk about the exact opposite. We're going to talk about the nightmare stories of facelifts, because what I like to do with the show is always present both sides of the coin. And we're going to talk about what could have happened. What are the things that patients need to be careful about? What are the things, and we'll point them through, I'll take them through the journey through your experience and point out where things could go awry, because every experience in life is two-sided. And what we want, and the purpose of having you on, is to talk about what is realistic, what can happen with two people, both of you different human beings, have almost similar, identical experiences, but then we can talk about what we hope never happens to anyone. All right, let's take a quick break. We'll be back with the second half of Plastic Surgery Uncensored. All right, guys, welcome back to the second half of Plastic Surgery Uncensored. All right, so I think it's, as I was telling you guys off camera, I think the purpose of my show or the podcast is always to show both sides of what could possibly happen. We are lucky, we are blessed. It was fantastic. Two of you independently went through two similar surgeries, common denominator me, and both of you had almost identical, plus or minus a little bit, of experiences, both in terms of recovery, how quickly you got back to doing stuff, similar surgery, scars. Both your scars look extraordinary for, it's not even been in you 2 years, in you it's been less than a year, right? Or
yes.
Year and a half or whatnot. So awesome. And that's what we pray for everyone. But that isn't the case for everybody. And we would be remiss to talk about facelifts on the show and not talk about all the things that can go haywire, okay? So let's go through the risks of facial rejuvenation, particularly facelifts. Number one is bleeding. Bleeding these are the catastrophic complications. These occur immediately. So you come out of surgery and you're in recovery, or you're at your hotel, or you're in the recovery center, and it's within the first 24 to 48 hours that all of a sudden the right side of your face is ballooned up and 3 times larger than your left. What the F? What's happened is you're bleeding. You're bleeding. When you lift up the skin and you get in there, there are hundreds of tiny little blood vessels, and each of them has to be cauterized. That's why we want to make sure that you're relaxed and calm and not doing too much and not elevating your blood pressure the days after, because we don't want any bleeding. So if that happens, what do? It's an emergency. It's a, hey, doctor, whoever, I need to go back to surgery now. Why now? Because if the hematoma, blood, stays there too long, it puts pressure on the skin, because the skin's being stretched. And if the skin's being stretched, it can necrose and die. So it is a relatively big emergency. What happens if you call your doctor and there is crickets? Have you guys ever thought of that? Did you ever think that when you call your doctor's office, you get a, hi, you reached the office of Dr. John Smith. We are not here. If this is a life-threatening emergency, call 911. What the? You're going to have to call 911. You're going to get in an ambulance. You're going to go to the local hospital. Who on earth is going to fix this problem for you at the local hospital? After you spent all that money to have this beautiful work done, and that whoever's on call is going to come fix this, they're not going to give two shits about you. When you call my office, 24 hours a day, who do you speak to?
Sally.
It's true. Sally's awake 24 hours a day. You speak to a live operator, a human being. Hi, how are you? This is Jane. This is Dr. Rahban's service. How can I help you? We're having a problem. My husband's face looks like a balloon. I need to speak to Dr. Rahban right now. It's 3:30 in the morning and it's my anniversary. Ding, 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 ding. Hey, what's going on, Sam? You can, I'll be annoyed. I'll be like half asleep, but you're going to talk to me. 3:30 in the morning, it's my anniversary. You're going to talk to me. What's going on? I don't know, Lance's face is like a balloon. It doesn't look right. All right, okay, calm down. Send me a few pictures. Okay, here, did you get them? Did you get them? Yeah, I got them. Well, okay, come. He has a hematoma. I need to see you guys. I'll see you in an hour and a half. Come to my office. We'll call the anesthesiologist. That's how that's managed. Anything other than that, you're fucked. So hematoma. Now you understand why you pay more, see more. It's not for the everything works out. You don't have insurance for when everything works out. You have insurance when a semi hits T-bones your car. That's why you have insurance. The second thing is necrosis. Necrosis is, oh my God, the skin behind my ear is turning black. Why would that happen? That means that the blood supply that reaches to that skin is not making it. We're cutting all around. That can happen with your nipple during a breast lift. That can happen with your belly button or your skin with a tummy tuck. Anytime you cut, lift, pull, that skin can die. Major problem, don't you think?
Yeah.
Right. So your surgeon needs to be very careful in how they handle that tissue. It's very fragile. Okay. Next, you can have nerve damage. Holy crap, what nerve damage? And it's sometimes or often permanent. Where would the nerves be involved and what nerve damage are you talking about? So the only disadvantage to having the deep plane or SMAS-based facelifts done is that when you go under those muscles, remember those muscles we talked about? Yeah. What's under there? A shit ton of nerves. And what nerves are those? Those are all the nerves that move your face. Close your eyelids, make you smile, move your mouth. Everything that happens in your mouth comes out of a handful of nerves, and they're right under the muscle, and they're right there. And that's why a lot of doctors don't want to do this procedure, because it's scary, time-consuming, and it has a lot of risk associated with it. But if done correctly, just like heart transplant, it's effective. But you got to be careful, and you got to take your time, and you got to be very judicious and conservative under the muscles. Because if one of those nerves gets cut, it will not come back, and there ain't no fixing it. It's very, very difficult to do. So nerve damage, that's another thing. Now we're going to talk about asymmetry. That's so odd. My right side doesn't look anything like my left side. You will 100% be asymmetric. That's a given. No doubt, no questions. But I'm talking, who was on your right side, who was on your left side? You experienced that with your arms, didn't you?
Yes.
Right?
Yes.
And what do you think happened there?
I think there was two different surgeons. They look completely different.
Right. And when you came in and you showed me your arms, I was like, well, no, there's just no way.
Right. Right. And that's when you explained to me that you're your own surgeon. You will take hours.
Right.
Upon hours. You might hate me at the end of it,
I
but
will
you
hate you. I
take
won't mind.
hours. You'll be cussing me out halfway through it, but you would be taking.
Right. And people are like, what do you mean you alone? Who else are you talking? You're the... very important. Surgery is not always and not often done by the surgeon alone. Many times, especially on things that require a lot of sewing, someone else comes in. Who's that someone? The tech, the nurse, the PA, or another surgeon to help assist so that the surgeon can get going, move faster, get to the next case, save time. So in your instance, it is super common for someone to do the right arm while someone does the left arm. With the facelift, the surgeon often throws a bunch of stitches, handful, to set the flap, set the skin in, and then leaves. And then someone will close the rest of it, right? Because he's having his coffee, sending a couple of emails, the tech will close. It's very, very, very common. But if you're sitting there the whole goddamn time, closing and closing and closing, then you are the only one involved. Yeah. So asymmetry is a big, big issue.
Yeah.
Right?
Yes.
That's the first question I would ask.
Right.
Yeah.
Next is horrible scarring. So you do this facelift, your whole point, the whole dream is to wear your hair up in a ponytail. And now you can't. Why? Because you got to wear your hair to cover the scars that are visible from 10 feet away. So the scars, there you go, exactly. You better you got to show your scar. So the scars that are in front of your ears and behind your ears and in your hair can become visible. And the reason is twofold. One, it's shitty closure. Somebody just didn't take their time. But the other is from too much tension. So what we do with a facelift is release everything, pull everything, cut every excess out, and close. But what's preventing it from pulling right back down? That's where the muscle layer is so critical, because you're putting the weight of the pulling on the muscle, which is inside. So the skin is not under a lot of tension. When the skin, oh my God, they've removed too much skin, you look like you're in a wind tunnel. When they've removed too much skin, aside from you looking weird, we call it windswept, right? The corner of the mouth gets pulled, the skin gets pulled. Aside from looking windswept, when you've removed too much skin, the scar starts to thicken. because there's a lot of pulling on the scar as it's pulling back down to where it began. You can't just remove as much as you like.
Yeah.
There's too much and there's too little. And so you have to remove the right amount. If it's too much, the scars will get really ugly. Then when you go to fix it, it keeps occurring because you were already deficient in skin.
So it was too tight.
Exactly. Too tight from the beginning. The most common sign of too tight is earlobes. It is called the pixie ear. So the shortest distance from your mouth to your face is from the corner of your mouth to the corner of your ear. It's the shortest distance. So when they pull, they often put tension right at your earlobe. And then the earlobe starts to pull and your earlobe starts to get pulled forward and it gets like a dart. That's called a pixie ear. And that dart is a reflection of often too much skin being removed and too much tension on the earlobe. Both of your earlobes have settled in with incredible looseness, right?
Yes.
They're flopping. They're like they were before. The telltale sign of a facelift, if you ask a surgeon, is they're going to look at your earlobes and they're going to notice a bit of a pixieing, pulling down. And that occurs because too much skin was removed and all that tension was just thrown onto the corners of the skin on your face and it's going to pull it down, right?
Yeah.
So that is a very, very common issue. Does that sound, you guys feeling more, like, are you feeling more excited about how wonderful?
Yeah.
Yeah.
I can
I'm like,
see your
I'm glad we didn't have this conversation before.
Oh no, we had this
we did.
conversation.
I didn't listen.
Your ears were just like, la, 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 la. I'm not listening. Oh, I guarantee you I told you this shit. I tell everybody.
Yeah.
Everybody this stuff. Because you need to know why you went out of your way, why you paid more, why you spent time at hunted down so-and-so, why this doctor doesn't have that gimmicky name and the other one does, why. And if no one explains this stuff to you, I am definitely brutally honest, and I absolutely will never not tell you what you need to know. And if as a result of what I just shared with you, you're like, well, screw this shit, then that's the right answer. Then this is not for you, right?
Yeah.
This is for someone else. So those are, in my opinion, the major fucks of facelifts, right? Other things can occur here and there, whatever, but these are the main oh my gods. And what you want is to look like you guys. Normal.
Yeah.
Normal. And normal is what? What did you do?
Right. A softer version of me. That's really what I wanted.
Correct.
I was very concerned about not looking like myself.
Right. And so the main concern that people have about facelifts, just generally, is I'm going to look like one of these weird celebrities. And the weird celebrities we're talking about, may she rest in peace, Joan Rivers or whatever, people who've had like multiple facelifts or whatever, and it's this sort of pulled back, super weird fake look. And that is not an issue of facelifts. That is an issue of surgeons. The issue is not the facelift. The issue is the execution of the facelift, right? Here you are a man, totally normal looking. Here you are a woman, totally normal looking. And neither of you, I guarantee you, anyone would ever know that you ever did this. Well, of course, now you're famous, but not prior to this, you were guys who were anonymous, right? And so I think that's really the goal, right? Is to do that. So, are you happy?
Yes.
To just make of all the surgeries you've done, right? Breast, tummy, body lift, arms, all those things that you've done because of having had weight loss. Would you say this is your favorite? What is your, yes, what?
Hands down, it's my favorite. My tummy is another. It's nice as a woman who's had 4 children not to have the tummy, but I just would encourage everybody to do this. Like it is a game changer.
At 55, she's more beautiful than she was at 19.
Yeah.
Look it out right there. You're a keeper. You're going to get hundreds of, where do I get a guy like that? So, and then for you, would you say, you know, what was the impact for you as an individual, as a man, you know, amongst your guy friends? Did you get a lot of flack for it? Did you get guys giving you shit for it?
No, not at all. I mean, we really don't talk about our, hair or nails or anything like that. I mean, it's not.
Did you get any positive reinforcement? Like, bro, you look great, man. What'd you do?
Yeah, it's a lot of that,
They thought he had lost
Yeah.
weight.
Yeah.
They thought you like
And working out.
And did you find that it was interesting because women chat amongst themselves all the time, but do you find guys come up and be like, "Hey, hey, what'd you do? Hey, can you tell me what you did?" Like one of those, like, "Hey, I'm curious. Can you give me some info on that?"
Yeah, some of the guys, yeah, sure. Yeah, so a little bit about,
The neck,
the turkey neck's gone and stuff like that.
and the jowls too, because he was very hollow through here.
Yeah, I'm curious because women don't chat all the time. I'm like, come into the bathroom. Let me show you. What it is."
Oh no, I'll show you right here ahead.
Guys are not, they don't, but they'll ask because they want to look, do the same.
Sure.
So I love that. So now the last question before we leave, I want to know the impact of facial rejuvenation in your marriage as it applies to the way you see each other. Now, before you answer the question, I don't want to hear some corny ass bullshit about she was pretty before, he's handsome before, because while I know that you guys have been married for 30 some odd years, you have 4 beautiful kids, you've been together since you were 15 and 16. Your love transcends all of beauty. If she was wearing a bag and you were blind and he was quadriplegic, you push him around her. I don't want to hear any of that nonsense. It's fucking bullshit.
Yeah.
If she suddenly gained 700 pounds, shaved her head, and tattooed, moon on her forehead, you can't tell me that when you look at her, it alters the way you look at her. So, with that preface, I want to know, for someone who's been married so long and been married together for so much and you love each other, how the intimacy component of looking at your life partner and then seeing them reversed, how that's impacted the way you feel inside. So I'm going to start with you.
It is different. I'd say 5 years ago, maybe I would look into her eyes or at us in a picture and think that, boy, we're getting older, and now that thought, there's a different thought. When we look at each other and I look at ourselves in the mirror, I think, man, we're looking better.
Right.
I'm not younger maybe, but
Yeah.
we're looking better. Not instead of that, we're looking older. We're looking better.
Yeah, I love it. And do you find her more attractive?
Yes.
Right? People don't want to say those words. It's like you're not allowed to say that. Yeah. What, I wasn't attractive before? No, that's not that.
Right.
She is more attractive. The end.
Yeah.
It's
Right.
just, you can't tell me that she's not more attractive. When someone's more attractive, I desire them more. And that's what I'm trying to get people to stop. This nonsense woke concept drives me insane. The fact of the matter is, you would marry her and be with her by her side for the rest of your life. But that doesn't change the fact that you find this person sexually attractive and that person not sexually attractive.
Yeah.
And she is a prettier version of the woman she was 2 years ago.
Yes.
Absolutely.
Definitely more attractive than she was 2 years ago.
Yes.
Yeah.
So that.
But you didn't like me 2 years
See?
ago.
Throw him under the bus. All right.
I'm just kidding.
Now, you as the woman, what is your thoughts in terms of the impact this has made in the changes that you see in him physically?
And changes I see in him, I just think that he's just super handsome. Even not to get too personal, but even in sex.
But
right?
that's the point.
I'm super more confident.
100%.
And then to look over at him and he looks incredible. Like, yeah, man, why did we wait so long?
So, but this is the dialogue that I think people don't click on. All that we try to do as human beings is cultivate the highest quality moments we can. So, it's not forever. Things happen. Shit happens. But for example, in the moments of intimacy, I'm intimate. You're laser focused into one person, hopefully your life partner. There is nothing more powerful than you feeling attractive,
Yeah.
them looking good, and the peak of that, because it then is the grease that greases the relationship.
Yeah.
We've moved away from this concept. We're not allowed to talk about it. It's not acceptable. It's not cool. You're not allowed to say that someone looks pretty or ugly or fat or whatever. It's all this is buzzwords that I'm not allowed to say. And what I want people to understand and admit is that it does matter.
Yeah.
And we are never going to that's never going to not matter. It mattered 500 years ago.
Right.
And it's going to matter in 500 years because we're built as humans For the love of God, bees are attracted to prettier flowers.
Yeah, sure.
Lions mate for the purpose of reproduction of their kids. Everything that's created by God has this gravitational force. And for us to sort of just delete that, it's just insane. I'm not suggesting that superficiality is going to make up for the connectivity you have. But I'm saying when you have this such a great connectivity, why not buff it and make it shiny?
Yes.
Right? So I love that. And, I thought this particular episode about talking about facelifts had a 2-component element. One was, of course, we talk about, I think people always are curious about facelifts. How come your people are doing it younger, 53, is that okay? It's going to look weird. Let me see your scars. Oh my God, your scars look gorgeous. Like you can't even see anything, et cetera, et cetera. At the same time, you get this unique element because you have these 2 people who loved each other and they both get facelifts, and then you want to know, like, what the fuck? How's this going on?
Damn.
Yeah. And I think that was, I think it's a very, very special, unique opportunity. Well, all right. So, as always, I really appreciate it. I think the show is awesome. I love my show because I think the information we give out is top notch, but the show sucks if we don't have people like you sharing their stories, being vulnerable, expressing themselves. Because anyone who's listening doesn't really want to hear anything I have to say. They want to hear what really happened to people who had what we talk about done. And so I'm grateful that you guys are on and having your conversations and being candid and sharing it, because you got to put yourself out there to help other people. So I think a lot of people will benefit from this dialogue.
Good.
Great.
Good.
Because I'm running out of data face tomorrow. All right, guys. Well, that wraps up another episode of Plastic Surgery Uncensored. My imparting 2 comments. Number 1, if you love the show, go write something sweet, nice, kind. Maria loves to read them at the beginning of every show. And secondly, please share this with the people you love. You think you know them and you don't. Next thing you know, they went and had, I don't know, circumferential body lift rejuvenation, and you didn't tell them about the show and something horrible happened. So share, download, and subscribe. And we'll see you guys next week. That wraps up yet another episode of Plastic Surgery Uncensored.